Welcome to the Attention Deficit Disorder Expert Podcast Series by Attitude Magazine.
Hello, everyone, and we're glad you can attend Attitude's weekly ADHD Experts webinar. Just an introductory note before we get started. If you've listened to one of our webinars before, you know we offer attendees a certificate of attendance. When the webinar ends, a post-event survey will pop up. It will list 3 questions about the quality of the webinar, followed by 3 questions titled Required for Certificate. If you would like a certificate of attendance emailed to you, you should answer those 3 questions. If you don't want a certificate, obviously don't bother answering them. Now for the theme of today's webinar, marijuana and the ADHD brain. As more and more states legalize marijuana, the general acceptance of cannabis as safe and medicinal has sort of taken hold. But studies show that isn't the case, especially among those diagnosed with ADHD. Those with attention deficit carry a higher risk for substance use problems and are especially vulnerable to cannabis's effects physically and psychologically. Those effects are mostly negative. Cannabis can adversely affect motivation, memory, focus, processing, and learning. It can also affect balance, posture, coordination, and reaction time, and not in a good way. We are very happy to have Roberto Olivardia here today to talk about the latest science behind the cannabis-ADHD connection. Dr. Olivardia is a clinical psychologist and lecturer in psychology in the Department of Psychiatry at Harvard Medical School. He maintains a private psychotherapy practice in Lexington, Massachusetts, where he specializes in the treatment of ADHD, obsessive-compulsive disorder, body dysmorphic disorder, and eating disorders. He has done numerous webinars and presents at many talks and conferences around the country. You can ask questions of Dr. Olivardia at any time during the webinar. We will try to get to as many of them as we can after his presentation. To download the presentation slides of this webinar, check the drop-down menu labeled Event Resources on the bottom left of your screen. If you do not see the Event Resources tab, you need to refresh the page. So now, after all that housekeeping, let me turn it over to Dr. Olivardia. Thanks for being here today.
Oh, thanks for having me, as always. Very passionate, actually, to be talking about this issue of cannabis as it affects many young patients that I work with, teens and young adults who have ADHD, as well as something that really is affecting adolescents and young adults in the country. Just some important notes. I first want to start off that I don't have any political leanings around this kind of issue. I'm going to be speaking to the science of it. And in preparing this, I delved very much into the literature and am just reporting to everybody what we know about the science. So I'm not talking politics or legalization. I won't be discussing non-cannabis related vaping. And I won't be going so much into CBD, which is the non-psychoactive properties of cannabis, except to say that right now there isn't any substantial evidence that shows that CBD is helpful. There isn't a lot that says it's particularly harmful, but it's not particularly helpful. Maybe that could be a webinar at some time in the future. Also, I'm going to be talking more about the effects of THC and cannabis on the developing brain. So these are brains prior to the age of 25, 26, and considering that people with ADHD, we know that their frontal lobes take a little bit longer to mature. For people with ADHD, we could be talking about a developing brain prior to the age of 27, 28. And for people to keep in mind that all of what I'm presenting today is much more impactful for an ADHD brain, that the ADHD brain is more vulnerable to the effects of everything I'm about to discuss. So first, what is cannabis? So cannabis is a plant of which there are different strains. There's one known as the sativa or indica, which are sort of known for different psychoactive properties. One might be responsible for what they call a body high, the other for a head high feeling. But actually studies show that even though One might be more synonymous with a certain kind of high, that there are most of them are actually more hybrid strains. And studies have actually shown that even when people go to dispensaries to get, let's say, a sativa, a sativa or an indica, that they're more likely actually getting more hybrid strains, even when they're not aware of it. There are two active compounds that you'll often see in cannabis. One is known as delta-9 tetrahydrocannabinoid, or THC, which we'll be talking a lot about. And the other is cannabidiol, or CBD, which we won't be talking as much about. The plant contains also 500 other chemicals, including more than 100 compounds that are chemically related to THC, called cannabinoids. So there are different forms of how cannabis can be taken in. People can smoke it in the form of what's called like a joint, where it's hand rolled into like cigarette paper. It could be smoked through pipes or water pipes known as bongs. It can be rolled in cigar wraps, what's known as a blunt. There are a lot of edible ways that people can ingest marijuana, cannabis, whether it's mixed in with cookies, brownies, candies. It's actually quite disturbing that a lot of these candies are wrapped in wrapping that looks like everyday childhood candy, things like gummy bears and lifesavers and things like that. And sometimes you almost have to take a double take to realize, oh, wait a minute, this isn't, regular package of gummy bears. As one of my 14-year-old patients brought in a bag, to show how it could look, like everyday candy. It can be vaporized. And there are concentrated resins that are really that are often burned or vaporized to produce very, very high THC doses in the form of what they call hash oil or wax or dabbing or shatter. And I'll talk a little bit more about why people do that. So what cannabis basically does is we have these receptors all over our body, and they're known as cannabinoid receptors. Now, I want to be clear. They're not called cannabinoid receptors because our body is meant to consume cannabis. As one of my young patients said, well, then why do they call them cannabinoid receptors? Doesn't that mean that cannabis is natural and meant for the brain and the body? No. They're called that because cannabis, they find, actually mimics other brain chemicals that fit into these receptors. So THC is able to attach to molecules. And there are molecules, one is called 2-AG, another's called anandamide. And as you can see in the bottom right picture, that anandamide and THC look fairly similar. So THC kind of can fit like a key into a lock into those receptors. Now, what it does is it activates those receptors and disrupts them, and which then really cause a cascade of different mental and physical consequences or functions. So in a nutshell, what THC does is that when we have different neurons or nerve cells in the brain, you have one nerve cell that then secretes different neurotransmitters and communicates to another nerve cell, which then secretes neurochemicals to another one, and so on. What cannabis does is that it actually inhibits that neuronal connection. And in a lot of ways, rather than neuron A communicating to neuron B to neuron C, neuron A could communicate to neuron B, and then neuron B might communicate back to neuron A, which gives too much feedback sometimes to those previous neurons, which then slows down the signaling and communication between neurons. Excuse me for my cough. So it actually produces a slowing down signaling process in the brain, almost like a dimmer switch of a light. So now you're not getting as strong signals that are kind of communicating through the brain because of THC. Now, just a note that marijuana is now, especially with legalization in many states, is said to have medicinal properties to them. And in looking at the literature, there are three cannabinoids that have been FDA approved for the treatment for some pediatric epilepsies, for some chemotherapy-induced nausea and vomiting, and for HIV-related conditions like the wasting syndrome. That's pretty much it for FDA approval. Now, you'll see in the literature people with post-traumatic stress disorder, who are prescribed marijuana medicinally. There are no studies that actually show that that's an effective treatment for post-traumatic stress disorder. In fact, it could actually exacerbate the symptoms of PTSD. Now, that doesn't mean that people might not take it and say that it calms them down and it might help them sleep. It does do those things, but that doesn't mean it's good for them. In the same way that, if somebody were to drink a bottle of vodka, that might help them sleep that night, but none of us would say that drinking a bottle of vodka is a good thing to do. And that's a substantive coping mechanism. So the other thing to keep in mind is that a lot of these studies that show medicinal or that are purporting medicinal properties are often not at very high THC levels. And the THC that you'll see that people are using recreationally is quite high. So we need more studies to really make a full judgment around whether cannabis has any medicinal property to it. But right now, there are no studies to date that are really strong, methodologically strong studies that show it to be something that could be helpful, other than the conditions that I mentioned earlier. Now, I can give you as an example, a lot of the studies that have been done are fairly small sample sizes. This is one from Cooper and colleagues, 30 subjects, half were assigned to a placebo group, half to this spray that includes the strain of sativa seen in cannabis. And they found actually that there were no statistically significant differences after applying all the appropriate statistical methods in people finding some long-term relief in terms of things like nervousness or anxiety. In fact, one of the subjects who got the spray suffered some serious muscle spasms and seizures, and 3 others had mild adverse events in the study. So that wouldn't be what we call a robust finding by any means, where it didn't find a difference. Now, we also want to distinguish the difference between medicinal and self-medicating. Because a lot of times people will say, well, I feel good when I smoke cannabis, when I eat cannabis, it calms me down, it grounds me. That doesn't necessarily mean that it's medicinal. It might mean that it's self-medicating something. So just because something achieves effects, I'm not arguing that cannabis doesn't achieve those effects. It absolutely does. That's what makes it a drug. But, in the same way that we know that alcohol or people who use food or sex or gambling might achieve certain effects, but it doesn't mean that that's a healthy thing for them. Again, just because it's legal doesn't necessarily make it medicinal. Self-medicating brings you to an altered state. So when something is medicinal, we want that to bring an individual to an authentic, clear, focused state. So when someone is using a medication, for example, whether it's a stimulant medication for ADHD, the goal is to have them feel focused and grounded and clear-minded. And if that medication doesn't do that for them, then that's probably not the best medication for them or, for that particular person. So self-medicating also can lead to addiction, whereas when someone is properly medicated, they're not abusing the substance. They're not developing a tolerance for it over time. Self-medicating is done without medical supervision, which then puts people at risk not only for whatever psychoactive components are, but physically and medically, how it might interact with other medical conditions or symptoms that they might be having. Self-medicating can lead to overdose. And when there's proper medication monitoring, we have low rates of addiction. So again, the key is that proper medication is meant to bring you to authentic, clear sense of yourself. Now, the sad thing is that we know that the statistics are undeniable that cannabis is being used more and more by younger people, and it's increasing. So studies show that amongst people who use marijuana on a daily basis, that studies show that upwards of 1% of even people as young as in the 8th grade, we're talking 13 years old, use marijuana on a daily basis. 4.8% of 10th graders, about 8% or so of 12th graders use it every single day. Which then, when people make comparisons to alcohol, for example, which I'm certainly not advocating alcohol use, but keeping in mind that a lot of times with cannabis, with marijuana, you have higher rates of people that use it on a daily basis than you would with representative groups of people, let's say, of the same age group who are using alcohol. They often do not use it on a daily basis. So although one might say, well, is cannabis just as harmful as alcohol? There are problems certainly with both of them, but the use of it and also the illusion that it's something that could be healthy or medicinal leads people to use it more frequently, often, than they would with alcohol. And then when studies look at past year marijuana use, the statistics jump dramatically, that almost a third of seniors in high school have used marijuana over the past year. And that's pretty much in line with what I see in my practice as well. Now, when you look at college students, about half of college students have used marijuana over the past year. A quarter of them would report using it at least once in the prior month. And people who are same age peers but who do not go to college tend to have higher rates of marijuana use. Now, vaping, which is one of the ways that people can take in marijuana, cannabis, has doubled in college students from 2017 to 2018. So that particular administration is one that's becoming increasingly popular. When they look over in a 30-day prevalence over a month, that you find even from 2017 to 2018, it's doubled when you look at people who have vaped over the last 30 days. And similarly, non-college respondents, you'll find that the rates, are typically at higher levels, although they didn't have as much of a jump from 2017 to 2018. So daily or near daily use, and by near daily use, we're talking about 20 out of 30 days would be considered near daily use. Marijuana was 5.8% in 2018 for college students and 11.1% among same-age non-college youth. And these were studies that were part of a very, very large sample size. So these are pretty robust findings. So what is so negative about using cannabis? Well, one of the things that's important to keep in mind, unlike other drugs, when you're talking about cannabis or marijuana, it's often what's not happening that is the bigger problem. What we refer to as negative symptoms. In in psychology, we refer to negative symptoms as the behaviors or things that are not happening that should be happening. We refer to positive symptoms as the things that are happening that really shouldn't be happening. So to give you an example, a hallucination, which you would see in people with psychosis, is known as a positive symptom. So positive here is not talking about good. It's talking about the presence of something that is symptomatic. With cannabis, a lot of it are these negative symptoms. So a lot of times, even in research, when people are self-reporting about the effects of cannabis, it's often quite biased because people are not reporting, oh, I'm hallucinating or I'm doing all of these things. So a lot of times, even there's biased reports. It's more what's not happening. And there are many scientific studies on all of these things that I would quote, but I just don't have the time for. But there are very substantial studies that look at cannabis use as hampering motivation, both short-term and long-term, memory, that it actually alters the function in your hippocampus and your orbitofrontal cortex, which is where a lot of memory is processed. And this is particularly before the age of 25. So studies have actually looked at this particular issue of memory and find that after the age of 25, you don't see the effects as pronounced as you do prior in terms of memory impairment. The ability to shift attentional focus, to process, to learn, and take in new information. Now, mind you, I also want to be clear here that this is certainly when someone is under the influence of cannabis, but studies are also showing that even a day after or 2 days after they have smoked or ingested cannabis, some of these consequences are still happening. There are studies that show that even people when, for example, who use marijuana on a regular basis, when they're not particularly high, but driving, that they notice that their driving is impaired even when they're not high, still having it in their system even a couple days later. The ability to take in complicated tasks and break them down into executive steps, balance, posture, reaction time, coordination, motor coordination, all affected by cannabis. Increased appetite, sometimes to levels that could be unhealthy, where people are binge eating or overeating. Time perception becomes very skewed. As I mentioned, driving ability. One of the things that a lot of states who promote legalization, would argue is that with legalization, we'll see a decrease of drunk driving, of alcohol-related DUIs, and that actually hasn't necessarily been the case. And in some states, we've seen an increase in cannabis-related DUI, which is obviously, very disturbing. Blunted affect, which means that individuals who really don't have a lot of emotionality, they're sort of like just flat and robotic, and reduced impulse control. Now, this is just an example of what THC does to the brain and why it is so important, especially for anyone, again, who's a young developing brain, to understand. Now, this was a study done with adolescent rats. And in our brain, we have what we call these neurons. And out of these neurons are what we call dendrites. And dendrites are like, imagine branches from a tree. And we want our dendrites to be long. We want them to have as many side branches to them so that those dendrites can connect with other dendrites of other neurons. And that creates better processing, that creates better learning, that creates basically a healthier brain. So this is a picture of rats without THC versus with THC. And as you can see, the rats who were administered THC, their dendrites are much more bare, that there's less ability to make connections with other neurons. And these are not rats that were given super high doses of THC, that they were given sort of equivalent doses of what you would see in human beings, and not over a year's time. This is after a fairly short administration. And this is what should disturb people, is we are not 100% sure how reversible this is. That there are some studies that show for certain parts of the brain, it can be reversible when someone stops using cannabis, that there's still hope in terms of creating better neuronal growth. And in some parts, it may not be a reversible effect. And so what young people need to understand is they are literally altering the architecture of their brains. And that's not it's a dramatic statement, but it's not hyperbole. This is what the science is showing. Studies show that earlier usage predicts worse outcomes. The younger somebody is when they start using cannabis, you're going to see worse outcomes on all of those measures I mentioned before. Again, particularly when someone is younger than the age of 25, you'll see that the cannabinoid receptors are concentrated in your white matter of your brain, which is responsible for communication, learning, memory, emotions. Post 25, we see those receptors that start to be in other parts of the brain. But again, what's so important is that you're affecting the formation of neuronal connections. And as I mentioned, some of those effects may be irreversible. Now, there was a study by Meyer in 2012, and it was a very large longitudinal study, which meant that they followed people over several years and looked, this was a sample in New Zealand, and they found that adolescents who had cannabis use disorder, which I'll talk a little bit in more detail, was associated with the loss of average of up to 8 IQ points measured in mid-adulthood. So those who used heavily as teenagers and quit as adults did not recover those lost IQ points. So people who began using marijuana heavily in adulthood did not lose IQ points. So again, what this study shows is that for a developing brain, it literally affects, as I mentioned, your learning, your processing, which when we follow those people into adulthood results in lower IQ. When someone starts smoking or in taking in cannabis in whatever method, post 25, it's not that I don't want to paint a picture that it's all hunky-dory and everything's fine, but we know that the effects aren't as substantial as they are prior to the age of 25. And when, again, I'm using this age 25 because a lot of the research studies are purporting this. But when we're looking at people with ADHD, we want to bump that number up a little bit because we know that the frontal lobes are not totally developed and formed, sometimes in 27, 28. So there are also health-related effects of cannabis. People think it's totally organic and healthy. You cannot fatally overdose, per se, on cannabis or have a life-threatening withdrawal effect, but it can result in chronic bronchitis, COPD, emphysema, something called cannabinoid hyperemesis syndrome, which I had a patient who experienced that, which is these severe bouts of vomiting and dehydration. There are some studies that are linking it to potential testicular cancer in young men. And there's the issue of whether cannabis is a gateway drug or not. Now, we know that most people who are substance abusers start out by using either alcohol or cannabis, partly because of easier accessibility, especially now where it can be legal, and may graduate to other substances. So we don't know, is it truly a gateway, or is it that just happens to be the first substance that they're going to try? Now, there are studies in rats that actually do show that it can prime the brain, which would lend itself to a classic gateway theory that show that THC, especially at high levels, can prime the brain to have an enhanced response to other drugs. So that is very compelling, because what that shows, and what they call cross-sensitization, is that if somebody didn't, let's say if they administered or didn't give THC to rats and then gave that rat cocaine, that they're going to have a certain response from the cocaine. If they gave that rat THC and then gave them cocaine, they had a much more pleasurable feeling from the cocaine. So that meant the THC literally primed the brain to get a much bigger response from some of the other drugs. And that actually makes it more of a gateway that is very concerning with the THC levels that we're seeing today. Now, what a lot of people don't know also is the negative effects on the heart, that we think of cannabis as calming people down, chilling them out, they're relaxed. So how could this be bad for the heart? Well, it actually raises your resting heart rate, dilates your blood vessels, and it eventually results in your heart needing to pump harder. So the normal heart beats 50 to 70 times a minute. And when people are using cannabis, that can bump to 70 to 120 beats per minute. And that could last for up to 3 hours after somebody has ingested cannabis. So the risk of heart attack is actually several times higher in the hour after somebody smokes. And certainly if someone has any pre-existing cardiovascular issues, smoking cannabis could be a major risk for them. And it certainly increases the long-term death rate among heart attack survivors. So again, somewhat ironic, because I've worked with adults who have had cardiac events and then think that smoking marijuana is actually going to be a good treatment for post-operative care for cardiac events. And their doctors are saying that's not actually the case at all. It can lead to mental health disorders, and we know absolutely it exacerbates mental health problems. Now, in the short term, many patients who struggle with anxiety and depression will say that weed helps them. And on that short term, I'm sure that they feel those effects. What studies are showing and what I see clinically in the long term, it absolutely doesn't help their mental health problems. And it really actually contributes to them, and it can really exacerbate, whether it's paranoia, panic, depression. We're seeing a literature in the field of suicidology that is linking and correlating increased cannabis consumption with higher suicide rates. And we know it isn't as simple as like A plus B equals C. And at the same time, we know that something is going on in terms of how cannabis is affecting young people that could have all these different effects. Now with ADHD, as we're going to be talking about, absolutely has negative effects for and can develop into what's called a full-blown cannabis use disorder, which I'm not going to read all of these, but basically what we diagnose a cannabis use disorder is somebody who's starting to take cannabis in larger amounts over longer periods of time, try to quit and have a very hard time doing so, feel cravings or strong desires to use. It will interfere with work, with school, with relationships. They get themselves into physically dangerous situations because of it. And they feel increased tolerance and do feel a sense of withdrawal when they're not using cannabis. Now, one of the things you'll often hear is, well, marijuana isn't addictive. That's not true. Cannabis is addictive. In fact, 9% of adults who use regularly are addicted to cannabis, and 18% of adolescents who use marijuana are addicted to it. So that's almost 1 in 5 regular users are dependent on it. And 30% of people who use cannabis are thought to have some degree or certainly symptoms of cannabis use disorder. When you're under 18, you're 4 to 7 times more likely to develop a cannabis use disorder than if you start as an adult. And the withdrawal effects can be within the first couple weeks after quitting, things like irritability, sleep difficulties, mood dysregulation, decreased appetite, restlessness, physical discomfort. And that occurs because the brain is adapting to a large amount of the drug. And the more that when you put in a substance in your body like THC, the less your brain is going to produce what it needs to produce in order to regulate mood and do all of those things. And so it starts to need the drug and needs the substance to do that. Now, what's important to keep in mind is that the potency, when we're talking about cannabis, this is not the cannabis that people were smoking in the 60s. This is not the cannabis that people were even smoking or taking in the 80s or 90s, that there has been a dramatic increase in the potency level of cannabis. So in the early 90s, the average THC content in a typical joint or an administration of marijuana was 3.8%. In 2014, it's 12.2%. So it has almost quadrupled. That, ladies and gentlemen, it's a different substance in the brain, because now your brain, and again, especially for a younger brain, is being assaulted in a way that is very different than what you saw years ago. Now, keeping in mind, that might be a joint or when somebody is using a bong, the average marijuana extract sometimes can contain up to 50% THC. I've had patients who have consumed edibles or have dabbed, as I mentioned earlier, that high concentrated resin of dabbing or shatter that could be up to 80%. There are conventions that are around the country, pro-marijuana conventions, in which they have contests and challenges to make the highest THC wax. And they pride themselves on making THC or having wax of 80 to 90% THC. That is a completely different drug in the brain than something that is a 3.8% level of THC. So it's ironic that we're seeing legalization come at a time when the potency level is higher than it's ever been. So it's not a lot of decisions, actually, when I talk to people who, think about this issue of legalization, they're basing it on what the notions of cannabis was 15 years ago, 20, 30 years ago, not what it actually is today. Now, there's been a lot of talk recently about this correlation or this link between cannabis and psychosis. Now, frankly, when I first heard this, I thought, is it that it's causing psychosis, or is it that people who perhaps were what we call prodromal, which means people who were probably going to develop schizophrenia or schizoaffective disorder, are more likely to gravitate to marijuana, to cannabis when they're younger and are self-medicating. And therefore, when they're 19, 20 and we see schizophrenia, it's not necessarily that they smoked or ingested so much cannabis, it's that they were probably self-medicating an emerging psychotic disorder. So I was pretty skeptical myself, and I read a lot of the studies, and a lot of the studies couldn't really make that determination as to what's the chicken, what's the egg. Now, they would find, there were studies that have certainly found that cannabis users, that the more that somebody smokes, the higher risk they were to develop psychosis. We know that cannabis certainly is associated with higher psychosis for people who do have psychotic disorders, higher relapse rates, hospitalizations, more pronounced positive symptoms. And again, by what we mean by positive are the presence of hallucinations or delusions, the non-using psychotic patients. That if you have a family history of psychotic disorders, that the studies are pretty strong in finding that if you are a heavy cannabis user and have a family history of a psychotic disorder, you are at much larger risk of not only developing a psychotic disorder, but an earlier age of onset. And smoking high potency marijuana daily does increase the risk of psychosis by nearly 5 times compared to people who have never used marijuana. So is it that, the amount of the drug that's used, the age that people first use it, genetic vulnerability, all of these things can influence it. Now, I have had patients who do not have family history of thought disorder, psychotic disorders. They might be struggling with depression, ADHD. And I've seen what's called a cannabis-induced psychosis, which is a pretty scary thing where, and particularly it's correlated with high THC, either edibles or things like that. I have a patient, he was 16 at the time that this happened, and he took an edible that probably had about 70 to 80% THC. And for about 2 weeks, he had all of the symptoms of schizophrenia, of hallucinating, of talking to himself, of seeing things. It was frightening. And the doctor at the hospital said that he's seeing this all the time. Now, luckily, those symptoms subsided, and all of those symptoms went away. But we know that the fact that that can occur should be troubling to anybody in terms of what it can do to the brain. Now, there was a study that literally just came out as I was preparing this presentation that had me rethink maybe there is more to this cannabis psychosis relationship, where a study that I'm not sure how to pronounce the last name, Jorthoj, that was just done, that found basically did this real sophisticated study looking at genetic markers and different genetic overlaps between various disorders, and in fact did not find a genetic overlap between cannabis use disorder and schizophrenia, but did find that cannabis use disorder predicted schizophrenia. Now, why that's important is that it's showing there that it's not necessarily that people who are going to develop schizophrenia are going to gravitate towards cannabis use when they're younger, meaning that there really aren't a lot of genetic overlap there. And yet, we know that cannabis use can predict levels of schizophrenia, which says that this may be more or rather, it goes against the theory that people who are prodromal are just going to smoke more when they're younger. It's that we're seeing younger people smoke higher potency THC, and that is having a real assault on their developing brain. DeForty found that people who use marijuana and carry a specific variant of a gene called AKT1, which codes for an enzyme that affects dopamine signaling, are at risk for developing psychosis. So what studies are starting to look at is that it's not that everybody who smokes cannabis or uses cannabis is at risk for psychosis, but there are subsets of people who are. Caspi also found an increased risk of psychosis among adults who use marijuana in adolescents who carried a specific variant of a gene called COMT, which degrades things like dopamine in the brain. And COMT comes in 2 forms, what they call MET and VAL. I'm sort of breaking down a lot of sophisticated studies. And individuals with 1 or 2 copies of the VAL variant are at higher risk for developing schizophrenic type disorders if they use cannabis during adolescence. Those who only had the MET variant were unaffected in terms of psychosis. Now, what's interesting is that people with ADHD often carry this VAL variant, that we know that ADHD, that COMT gene is also implicated in ADHD in terms of dopamine signaling issues. So it may be that people with ADHD who develop a cannabis use disorder in adolescence are in fact at higher risk of psychosis. Now, that has not been studied yet, but I'm just looking for borrowing from these two different literatures and finding that there's something that might be there that is troubling. So Laughlin had done a study that 53% of non-daily users and 57% of daily users had ADHD. And studies also find amongst college students that ADHD is much more prevalent in people who tend to engage in daily use. Now, why the appeal, particularly for people with ADHD? Now, we know that cannabis activates the brain's reward system, and it releases levels of dopamine that are higher than what is typically observed. And we know that with ADHD, that dopamine is one of those pretty dominant neurotransmitters that are implicated in ADHD. So if you have a brain that's sort of low in dopamine or is a bored brain, basically, that something like cannabis could be very rewarding, and THC could be very rewarding in releasing dopamine. It also reduces GABA, which results in decreased inhibition. But in addition to those biological effects, people with ADHD are more likely to associate with other people with ADHD. We know that issues of low self-esteem, sensation seeking, sleep problems, poor impulse control all affect people with ADHD. Now, as I mentioned, this is the same slide I mentioned earlier, that all of the effects that we see with cannabis, you can imagine are going to be much more pronounced for the ADHD brain, because attentional focus, processing, learning, time perception, all of these things are issues already for people with ADHD that cannabis is merely going to exacerbate. Studies do show that there is a genetic overlap between ADHD and cannabis use disorder, whereas having ADHD will predict cannabis use disorder. Now, keeping in mind for parents out there, just because you have a child with ADHD does not mean that they're definitely going to use cannabis. However, we know that they carry a higher risk of substance use, and it's something to definitely be aware of. There is no evidence currently that shows that cannabis is helpful for ADHD in the long term. So what we do know that helps when people have a cannabis use disorder and ADHD is to treat the ADHD, that it's fundamental that we understand how important treating the ADHD is. And just as a brief note, that stimulant treatment is not a violation of sobriety. Unfortunately, there's still some rehab facilities in the U.S. that consider Ritalin and Adderall an illicit drug when it is not amongst people with ADHD when they're prescribed that. When studies have looked at motivations to quit, this is a very small one that Chuchard did, 23 people, that found that most people's main motivation to quit was to save money, interestingly, and that their most common strategy to maintain abstinence was to stop associating with people who were smoking marijuana, and most of them experience withdrawal. And studies show that when you stop using cannabis, that even within a week, people score higher on tests of learning. There's no approved medication for cannabis use disorder, but studies would support that you're treating the underlying conditions like depression, anxiety, ADHD. Support groups like Marijuana Anonymous are very, very helpful. Cognitive behavioral therapy, as well as dialectical behavior therapy, which focuses on skills of mindfulness, emotional regulation, tolerating distress skills, are all very important. Contingency management, which is basically, especially for parents, to build in rewards that can help, if somebody if they're sober and they're not smoking, that they can build up to get certain things. And similarly, if they violate sobriety, that they're behaviorally not going to get, certain things. And that has been found to be very helpful with substance abuse. And to call if you don't know where a local treatment center might be, 1-800-662-HELP is a number you can call, and they basically help find resources in your area, as well as this website, findtreatment.samhsa.gov. And then just a brief note for parents out there, to talk to their children, that look for windows to start talking about this proactively. It could be when you're in the car with them, and if they're listening to a rapper that smokes a lot of weed, asking them what they think about that, asking them if they, know of people who are smoking, because trust me, I mean, I work with 7th graders and 8th graders that know people who are vaping cannabis or using cannabis. Move away from the morality of it, because honestly, you're going to lose your kids in the conversation, and really just focus on the science as opposed to this is bad, we shouldn't be doing it. Unfortunately, the kids are going to roll their eyes and not really hear what you have to say, but focus on the science of it, of, wow, this is really disturbing what I heard about what THC can do to the brain. If your child is using, try to understand why they're using rather than, sort of being punitive initially around it. Is what does this do for you? Because we want to understand what it's doing for them. Is it making them less depressed? Is it helping them sleep? Because whatever it's doing for them, we want to find a healthier treatment or a healthy method and a treatment, a real treatment. The benefits that, yes, I can see why I could see why you would smoke weed if it helps you focus better. However, there are costs associated with that, and we can find another way to help you get that benefit. And promoting, again, this idea that weed is very different today than it was, yesteryear, and that we want to promote healthy coping skills. And another big thing, again, is explaining the big difference between the age of 25 after the age of 25. Now, certainly I'm not advocating that people start smoking weed after the age of 25. However, if your child, if somebody can get through, prior to the age of 25 and not using cannabis, the chances are less likely that they're going to start smoking in their mid-20s or using cannabis. But even if they do, the studies show that it's not going to be as impactful certainly on their developing brain as it would be when they're younger. So even as a parent to say, look, I don't have anything, more, even though, some people might have morally against it, but the science is the science, and it's showing it does pretty wacky things to the brain prior to a certain age. And that's really concerning. And certainly if you have a teenager that is using in the house, you want to establish clear boundaries and rules. It's okay to say I'm not allowing this in the household, and having very assertive communication around what is acceptable and what isn't. But for parents to know that knowledge is power, and to use whatever knowledge from this presentation, and to know that there's hope. Honestly, when I talk to kids about this, and I've shared with them a lot of this data, it kind of can freak them out a little bit when they hear about psychosis, when they see the picture of the neurons and things like that it really can get through to them, as long as they don't hear it as, you're bad because you're smoking weed, which we don't want kids to feel bad. We want to validate and understand where they're coming from. So we have about 8 minutes for questions.
That was excellent. Really, really good. There's some people I want to reference these folks. There's some people on here who can't stop smoking. Some are young adults, some are young adults, and some are just full-blown adults who say they've tried and they can't stop. They believe they're addicted. So that's serious stuff. So I wanted you to give them a few steps. I know you probably mentioned it in your next to last slide, but I was hoping, you might be able to direct them to.
Yes. Yeah. So first, I really empathize with them, because if for anyone who struggled, with any kind of dependence or addiction, it is a very, very difficult struggle. And specifically with something like cannabis, it doesn't get, I think, sometimes the same level of empathy because people think, oh, it's just weed. It's not coke, it's not heroin. But I've seen this destroy people's lives. And so my heart goes out to those people who are struggling. So this slide and the last, 2 is call that 1-800 number, go on that website, try to get resources, in your area. If there is a Marijuana's Anonymous support group, or any support group for substance abuse, it doesn't have to just be focused on marijuana. Although, I have to say that people who are cannabis dependent find it a little more validating when it's focused on cannabis, but sometimes those groups are just not available in their area. So they might go to an AA meeting for Alcoholics Anonymous, and you can still get the same support out of that, even though alcohol might not be the substance. Reach out to people, loved ones, friends, and explain to them sort of why it's difficult. If accessing sort of the cannabis is the problem, it's okay to say, you know what, I might need help in restricting my ability to get money out of my bank account, because money will just immediately go to, buying this. So do what you need to do to put whatever obstacles in place that help you not use. Rely on people. Don't feel shame around it, and understand that there's a biological, neurological mechanism that's making this so appealing, especially if you have ADHD. It makes it very, very appealing to the ADHD brain. We want to take the shame away from addiction and dependence. This isn't an issue, again, of your character. This is an issue of a substance that is being promoted as being medicinal and helpful and healthy and natural, but is really not that the case for people.
Mm-hmm. Excellent advice. Does cannabis affect the potency of ADHD medications that adults and kids might be taking?
It's a good question. I know that certainly with marijuana in general can affect the potency of SSRIs and other medications, as does alcohol. I haven't come across any specifically of stimulant medication, but I would hypothesize that it would, because when you're introducing a substance that is, you're bringing from the inside out, like something like THC, it's starting to have all these different kind of chemical effects, and your brain is going to go with where it's getting its greatest feedback. And so that's why the brain is going to find THC really appealing and want more of that. And so absolutely, not only is it increasing all of these cognitive symptoms and exacerbating ADHD symptoms, but if you're taking ADHD medication, it could very well be reducing the potency of your ADHD medication. So now it's this, triple threat in terms of helping, or rather harming your ADHD. So that's why the notion that cannabis is a treatment for ADHD is honestly laughable. I mean, it's absurd, because the evidence is overwhelmingly showing that it's quite the opposite.
Mm-hmm. Let's see. Secondhand marijuana smoke. One mom is concerned. I guess an older kid is smoking in the house, and the younger kid, I guess 7 years old, is ingesting this, inhaling the smoke. Any of those negative things about the brain and the neurons, would that apply in this situation?
Great question. I don't 100% know. I mean, these are the kind of studies that, now years ago, if you're talking weed from 20 years ago, you would probably find that wouldn't be the case. However, when you have higher THC weed, knowing that it's, could be vaporized and things like that, I really don't know. I mean, I would certainly be wary of that. I mean, I'm a music lover. I go to lots of shows and concerts, and sometimes, these concerts, people are, lighting it up. And I don't engage in the use of it, but I walk out of these shows and I feel something, and it's, from breathing, stuff in. So I wouldn't doubt that it might have some effect, again, especially for a young brain.
Mm-hmm. All right. There's this one, and it really presents a quandary. One mom asked, this son is 16 years old, has ADD and also a bone problem where he's using ADD, marijuana medicinally, and yet it's affecting his brain in the way you just outlined. And she says she's in a tough spot here. I guess there are situations in which you need to take it medicinally and you might have ADD, thus the problem.
Yeah.
Any thoughts?
Yeah. Yeah. And that's where it really requires, working with your doctor, working with your physician and seeing, is there another way, what the benefits that person might be getting for their medical condition, the marijuana, are there other ways that they could get that, to sort of, and being aware also is the medicinal simply being used medicinally? Is it something that the person is finding that they're increasing their sort of use of? Because having ADHD does make it more likely that the person is going to want to use more and more of it. So making sure that at the very least that it's monitored and supervised. So I'm obviously, I'm not this person's physician. I'm not a physician. So I would want that person to really be thoughtful. I think it's a great question because you want to be aware that there is a developing brain here and there's this medical, issue. And, but knowing that some of these effects could really have a long-term impact. And so if there is another way that that person can get the benefits of that medicinal treatment, without something that could be assaulting their brain, that would be, preferable.
Right. Well, I think the hour is up. That really was excellent. I learned so much, and I'm sure everyone else on the webinar did as well. So thanks so much for being here and presenting such great slides.
My pleasure.
Okay. And thanks for all the attendees for being here. We'll see you at next week's webinar when Maureen Bouchard and Karen Huberty show parents how to become an executive function detective to help your child overcome his or her challenges. See you then, and have a great day, everyone. Thank you.
For more Attitude podcasts and information on living well with attention deficit, visit attitudemag.com. That's ADDITUDEMAG.com. That's ADDITUDEMAG.com. That's ADDITUDEMAG.com.